Regarding the epidemiology of a breast carcinoma, breast carcinoma is considered the most common malignancy of women globally, and this includes the non-melanocytic skin cancer. And breast carcinoma causes the majority of cancer-related deaths in women. And the incidence and the mortality for this disease are increasing rapidly at an alarming rate, especially in the developing countries or the lower income countries. The major factors that underlie this trend in the developing countries are thought to be social change, including delayed childbearing, fewer pregnancies, reduced breastfeeding, and also the lack of access to the optimal health care. The lifetime risk of breast cancer is 1 in 8 for women living to the age of 90 in the United States, for example. And as I said, the incidence is increasing. So about more than 2 million women are newly diagnosed with breast cancer, 1/3 of whom will die of this disease. And almost all breast malignancies are adenocarcinoma. So the histologic type is adenocarcinoma. Regarding the risk factors for breast cancer, a large number of risk factors have been identified. However, we're going to discuss some of the most important risk factors. So let's start with the patient's age. Breast cancer is considered rare in women younger than the age of 25, but the risk will increase or the incidence will increase rapidly after the age of 30. This means that the risk for breast cancer increases with age. So about 75% of women with breast cancer are older than the age of 50. And only 5% are younger than the age of 40. The second risk factor is gender. So being a female is a risk factor because the incidence in men is only about 1% of that in women. Family history of breast cancer is another risk factor. And the greatest risk is for individuals with multiple affected first-degree relatives with early onset breast cancer, and also the personal history of breast cancer if the patient himself or herself have previous history of breast cancer. Other risk factors include physical inactivity, so lack of physical activities and exercise, and increased alcohol consumption. Reproductive history, including early age of menarche. Menarche means the first menstruation, so the risk increases when the first menstruation happens younger than the age of 12. Nulliparity, which means that this lady never have completed a pregnancy. Absence of breastfeeding, and older age of first pregnancy. Also, ladies who are exposed to exogenous hormonal therapy, like postmenopausal hormone replacement, and also postmenopausal obesity. All these factors are associated with increased risk, probably because each increases the exposure to estrogen. Race and ethnicity are risk factors too. Studies showed that higher rates of breast cancer are seen in high-income countries if compared with lower-income countries. And according to the CDC, in the US, the rate of new breast cancer is similar across the socially defined races, but the age at the diagnosis is higher in European Americans if compared with the Hispanic Americans, for example. And this is due to social factors that are related to parity and breastfeeding. Another factor, Hispanic and African American women tend to develop breast cancer at younger age, and the breast cancer in this group tend to develop in an aggressive manner. And this happens due to the differences in genetics and also social factors and the access to the health care. Radiation is another risk factor. So radiation to the chest increases the risk of breast cancer. And this is related to the time of exposure to the radiation, especially if the exposure happens while the breast is still developing. For example, breast cancer develops in about 25 to 30% of women who undergo irradiation for Hodgkin lymphoma in their teens and 20s. But the risk for women treated later in life is not elevated. So the risk for irradiation to develop breast cancer is related to the time of exposure. The major germline mutations that are associated with increased risk of breast cancer include BRCA1 and BRCA2 mutations and HER2 amplification. As you may know, BRCA1 and BRCA2 are classic tumor suppressor genes, which means that cancer arises only when both alleles are inactive or defective. BRCA1 and BRCA2 encodes for proteins that are required to repair certain kinds of DNA damage, and as you may know, they are normally expressed in many different cells and body tissues. Breast cancer risk increases in carriers of BRCA1 and BRCA2 in about 45 to 75% of these carriers by the age of 70 compared to 12% in general population. Regarding HER2 amplification, HER2 is a receptor tyrosine kinase that promotes the cell proliferation and suppress the apoptosis. Cancers with overexpression of HER2 are highly proliferative. Based on histology, breast cancer can be classified into non-invasive tumors and invasive or infiltrating cancer. A non-invasive breast cancer means that the neoplastic cells are still confined by a basement membrane, and they do not invade the underlying stroma, and there is no lymphovascular invasion. This includes two histologic types. The first one is ductal carcinoma in situ, and the second one is lobular carcinoma in situ. However, the second type of breast cancer is the infiltrating breast carcinoma or the invasive breast carcinoma. And within this group, we have different histologic patterns, including the invasive ductal carcinoma in OS, not otherwise specified, which accounts for about 70 to 80% of the cases, invasive lobular carcinoma accounting for 10 to 15% of cases, carcinoma with medullary features or medullary pattern accounting for about 5% of cases, mucinous carcinoma or colloid carcinoma accounting for 5% of cases, and tubular carcinoma accounting for 5% of cases. In the previous slide, we classified breast cancer according to certain histologic features into invasive and non-invasive breast cancer. So if the tumor cells are limited to the basement membrane and show no invasion into the stroma or lymphovascular invasion, then this is called breast cancer in situ, carcinoma in situ, including ductal carcinoma in situ and lobular carcinoma in situ. And if the tumor cells invade the basement membrane and infiltrate the underlying stroma, then this is called invasive or infiltrating breast cancer. And the invasive or infiltrating breast cancer is also classified into certain histologic subtype according to the histologic features. And this includes, as we mentioned, lobular carcinoma, tubular carcinoma, ductal carcinoma, carcinoma with medullary features, and the other histologic subtypes. Breast cancer is also classified based on the expression of three proteins, including ER, which is the estrogen receptor, PR, which is the progesterone receptor, and also the HER2, which is the human epidermal growth factor receptor 2, into mainly three biomarker defined subtypes or groups. And this classification is very important because this classification will affect the treatment for the patient according to the expression of these proteins. So according to the expression of these proteins, we have three major biologic groups. The first one is called luminal, and this accounts for 50 to 65% of the breast cancer cases. In this group, the tumor is ER positive, HER2 negative. HER2 group, which accounts for about 10 to 20% of cases, and in this group, HER2 is positive, ER can be positive or negative. And we have the third group, which is the triple negative group, which accounts for about 10% of cancer cases where ER, PR, and HER2 are negative. The three groups show striking differences in overall frequency, in patients' characteristics, in pathologic grade, and also in response to chemotherapy, metastatic sites, and the timing of relapse. That's why this classification is very important, because it's very important for treatment purposes and to predict the prognosis for your patient. This table shows you the three groups where we have striking differences in the patient characteristics, the pathologic features, the treatment response, metastatic pattern, the time to relapse, and the outcome. Non-invasive or in situ breast cancer. Non-invasive or in situ breast carcinoma includes ductal carcinoma in situ, DCIS, and lobular carcinoma in situ, LCIS. Both are composed of malignant clonal proliferation of cells. In both cases, the malignant cells are still limited by the basement membrane, so they are confined by the basement membrane and there is no stromal invasion or lymphovascular invasion. The extension of ductal carcinoma in situ through the lactiferous ducts into the skin of the nipple is called Paget disease of the nipple, and the presence of Paget disease of the nipple is often associated with an invasive carcinoma.